good afternoon and welcome to Bay Franklin Gulf Healthy Start Coalition's very first Lunch and Learn. I'm Kelly Burns Davis with the Healthy Start Coalition. And before I introduce our wonderful speaker, Emily, I wanted to make sure that everyone will go ahead and enter your name and the company or agency that you are representing in the chat so we can record who all is on the call with us today. We are so excited about the participants, the attendance that we have, especially with this being our very first one. And I want to make sure Emily has all the time to cover all the great information that she has on the effects of tobacco use and vaping during pregnancy. So it is my absolute pleasure to introduce our speaker today, Emily Kohler. And Emily started with Big Bend Area Health Education Center in Tallahassee, Florida, September 2012. She serves as the tobacco program manager, which includes implementing and facilitating cessation classes and tobacco treatment and dependence training for healthcare students and healthcare professionals. This role oversees the management of the tobacco cessation program and its employees who serve 14 counties in the Big Bend. Additionally, Emily regularly participates in community outreach and partnership meetings. Emily obtained her Bachelor of Science in Health as well as a minor in Exercise Science from the University of North Florida in May 2008. She was a member of the NCAA Student Athlete Advisory Committee, volleyball team, and track and field team. Her accomplishments at UNF include all academic, all conference, all American honorable mention, Hall of Fame, Dean's List, and President's Honor Roll. Emily also played professional volleyball in Europe and Florida, and I think that is so cool. She also obtained her Associate of Science in Dental Hygiene from Tallahassee Community College and became a board-certified registered dental hygienist in 2012. Emily has had a lifelong passion for health and health education, and we are so excited for Emily to share that passion with us today. So Emily, take it away.
Well, good morning, everyone. It's nice to see so many people on. I'm really excited and a tad bit nervous, but I'm going to go ahead and share my screen. I do have the PowerPoint to display, so give me just a moment to get that rolling. And you should be good. Everyone can see the slide, the effects of tobacco use and vaping during pregnancy on the screen. And everyone can hear me okay?
Yes.
All right. Well, as she said, I'm a registered dental hygienist and certified tobacco treatment specialist, and I'm the manager here at Big Bend AHEC over the tobacco program. So today I'm going to cover, give me just a moment. I need to turn something different. Okay, I'm going to cover tobacco use data and the impact of tobacco use during and after pregnancy, electronic vape product, which you'll hear me call 5 different things during the presentation because there's so many different names, really like over a dozen, but the data on those and what substances are typically in them, as well as the diseases caused or exacerbated by them. You may also hear me call them EVPs. That's, again, electronic vape product. Community resources for tobacco cessation. And then lastly, I am going to briefly mention our Navigator program right at the end, since open enrollment starts tomorrow. Yay. All right, I want to give you some general data first, just to get the big picture, and then we'll narrow down to the target population. So in the US, 11.5% of adults are current cigarette smokers. And while that number is down from almost 21% in 2005, it still represents over 28 million people. Historically and today, our men still smoke at higher rates than women, and those between the ages of 45 and 64, as of the last reported data, have the highest prevalence of smoking. And I want to mention, that when this product is used as directed and sold everywhere that it is, shockingly, every year it kills nearly 500,000 people who die prematurely from smoking exposure or secondhand exposure. That's 1 in 5 deaths, or 1,300 deaths per day. And, you know, it's also important to know that people don't always die from tobacco. More than 16 million Americans live with a smoking-related disease. For every person who dies because of smoking, at least 30 people live with a serious smoking-related illness. And I think that that is just wild, profound, whatever you want to call it. And while 11.5% of adults are current smokers, it's important to note also that there are huge disparities, with the greatest being among those who have a lower education level and those who have behavioral health conditions, like drastically higher, right? And then other notable disparate groups are those on Medicaid or disability who have low SES, and those who are divorced, separated, or widowed. Again, these are all in comparison to the average of 11.5%. And then you can see with education levels, when they go up, the tobacco, there's an inverse relationship with tobacco use, as well as the socioeconomic status and education level. So this is a chart of adults who smoke by racial or ethnic group, and it's displaying several years just so that you can see if there are any changes or variations, or maybe there are none for some years. But I want to point out, because down the middle, you see there are a white and black population there, and they smoke at a similar rate on any given year. But Black Americans are more likely to die from tobacco-related disease. Tobacco use is a major contributor to the 3 leading causes of death among Black Americans, which are heart disease, cancer, and stroke. And then diabetes is the 4th leading cause of death among Black Americans, and the risk of developing diabetes is 30 to 40% higher for cigarette smokers than non-smokers. So getting into our target population, 7.1% of women reported smoking anytime during pregnancy. The prevalence of smoking was highest among women aged 20 to 24, which is interesting because overall it was a different age group. But US statistics show that up to 40% of women quit smoking during pregnancy. However, more than half relapse within 6 months, and up to 90% relapse within a year. This is likely due to the stressors of sleep deprivation and raising, you know, a little human. As 2/3 of smokers report that they return to smoking because of stress. These statements are so significant that I have to read them. And I don't like to read exactly what's on the slide necessarily, but they're so profound to me. So I'll go ahead. Tobacco is the human development toxicant and teratogen with the greatest overall adverse impact on development in our population. First of all, can someone tell us what a teratogen is? Somebody want to be brave and unmute? So I can get a little, I'm going to ask you a couple of questions throughout this, so you might as well get ready to unmute.
Is it chemicals that are in chemicals,
Yeah,
like formaldehyde or things
they
like
are
that?
They are chemicals. I think of it as toxins, but there's something specific to the word teratogen having to do with pregnancy.
Specific.
Causes birth defects.
Yes, it causes abnormalities in the fetal development. Teratogens are usually discovered after an increased prevalence of a particular birth defect happens, and then they say, okay, now this is listed as a teratogen. So some medications, in this case, we're talking about tobacco or nicotine. And okay, so the next statement, thanks for answering that. I appreciate you getting involved. Smoking is the most modifiable risk factor for poor birth outcomes. And modifiable just means that it's a risk factor that can be controlled or changed. Quitting smoking is the most important action a pregnant woman can take to ensure the health of her baby. And smoking cessation at any point in gestation benefits the pregnant woman and her fetus. The greatest benefit is observed with cessation before 15 weeks, so just shortly after its transition from an embryo to a fetus. And according to the U.S. Surgeon General, eliminating smoking during pregnancy could prevent 10% of all infant deaths due to perinatal conditions. Sorry, I didn't try to put all these. I don't like to do things like this. I just like it to show up all at once. Sorry about that. A study of maternal events for antepartum hospitalization or prenatal hospitalization comparing smokers to non-smokers found higher rates of many different health conditions, which some of these are very severe. So a lot of respiratory problems, stomach ulcers, obesity, heart attacks, deep vein thrombosis, stroke, asthma, and also substance use disorder and hypertension. Some of the pregnancy complication risks from smoking are, and you may have heard, if you've been pregnant or you deal with pregnant women, you've heard all of these terms probably, because I know that when we got pregnant a year and a half ago, or 2 years ago almost now, look at me trying to math backwards for my baby's 14 and a half months old. But some of they are preterm premature rupture of the membranes, or PPROM. And then placenta previa, which is a condition where the placenta lies low in the uterus and partially or completely covers the cervix. And then placental abruption, which is when the placenta separates early from the uterus, or in other words, before the childbirth. And it occurs most commonly around 25 weeks of pregnancy. Symptoms they may experience include vaginal bleeding, lower abdominal pain, and dangerously low blood pressure. And then second to last is the ectopic pregnancy, typically in the fallopian tube, but not always. And then stillbirth. So none of which you want to experience during a pregnancy. And smoking contributed to all of those. So let's talk about the fetal impact from smoking. So nicotine, again, a teratogen, and carbon monoxide, a poisonous gas, both rapidly cross the placenta and concentrate in the fetus, resulting in 10 to 15% higher fetal concentrations than maternal concentrations. I found that to be very interesting. I didn't know that. I learned it in my research for this. And then we have decreased uteroplacental blood flow in the presence of carboxyhemoglobin in the blood, which is also known as carboxyhemoglobinemia, results in fetal hypoxia and malnutrition. This also contributes to fetal growth restriction, and we'll talk about low birth weight baby and that impact once the baby is born. But so another interesting thing to me when we look at DNA damage to have learned, during a pregnancy experience is, and y'all may know this, but I didn't know it before having a baby. So you're born with all the eggs you'll ever produce. And the mother who smokes during pregnancy can damage the DNA of their future grandchildren. That's mind-blowing to me. And these marks are made in the process called methylation. And that is alteration of the DNA that can inactivate a gene or change how it functions, often causing cancer or other diseases. When a mother has used tobacco during pregnancy and or continues use after delivery, it poses many risks to the baby after birth. 1 in 5 babies born to mothers who smoke during pregnancy has a low birth weight compared to about 1 in 12 babies overall. Low birth weight babies are more likely to die in their first 2 years of life, and the risk of having a baby in the smallest 5 to 10% of birth weights is as high as 2.5 times greater for pregnant smokers. And then babies whose mothers smoke are about 3 times more likely to die from SIDS, and this is the leading cause of infant deaths. A mother smoking affects the baby's lung development and increases the risk for many respiratory issues. As you know, it's one of the last things to develop on the baby, the lungs. So it is vulnerable, especially when we consider a preterm birth, low birth weight, and smoking also appears to be associated with small increases in major birth defects that involve the heart and great vessels, limbs, skull, genitourinary system, the feet, the abdominal wall, the small bowel, and muscles. Sorry. So here we have included in a list our direct effects of in utero tobacco exposure, as well as environmental or secondhand exposure. There's a strong association, as we mentioned, between smoking during pregnancy and SIDS independent of environmental exposure, which is interesting. So the smoking during the pregnancy increased the risk of SIDS later, even if there was no secondhand smoke exposure, to put that in a little bit better layman terms. So other risks to children of parents who smoke are, all listed here, but respiratory infections and conditions, ear infections, so more frequent ear tubes to treat that, colic, elevated blood pressure, childhood obesity, type 2 diabetes, leukemia, and also, most importantly, probably, as the brain develops starting in utero all the way through age 25 years old. And exposure to the teratogen nicotine causes cognitive, emotional, behavioral problems, as well as a greater risk for them to have substance use disorder or, other addictions later in life. So really here, the message is, if you can't quit for yourself, maybe, please consider quitting for your baby. So because I'm talking to the Bay, Franklin, and Gulf Coalition for Healthy Start, I wanted to include at least a local slide about each of the counties. And this is displaying resident live births to mothers who smoke during pregnancy for Bay County. And really, to looking at this, Bay had significantly higher percentage than the state for a number of years, but has recently come within close range to that of the state. And then for Franklin County, we see displayed here, while they have been above the state percentage for nearly 20 years of data here, they've aligned with the state in the last year reported. So some positives here, as well as for Gulf County, kind of up and down here. But the good news, again, they're going on a downward trend in the last reported data. I did want to ask, why do you think there is a downward trend for all of the counties? What are the factors at play here? Take a sip of water.
I mean, I think it's, the education, the smoking cessation programs that we have, at least in Healthy Start. We have various programs like Script, and also Let's Talk About Tobacco.
Yes.
And I'm sure there's other places where women who are pregnant are seeing specific ads about the risk associated, with pregnancy and poor birth outcomes and how it affects them.
Yes, great answer. I think that's a perfect idea. I filled that in as one of my possible responses as well, that there's a correlation of the funding for these cessation programs and even incentives that are given in some of the programs. I have two other things in mind that might also be a factor, because I'm sure what you've just said is definitely one, and why there is funding for it, because it's working. But what are two other things? Can you think of anything else? Somebody raise their hand. You can unmute and blurt it out. Or
go ahead, Stephanie.
Yeah, this is Stephanie Cash with Franklin County and Gulf County. I'm curious to know if the data includes women who report vaping versus just smoking.
No, this is just smoking in this data.
So I suspect that the data for smoking went down because vaping went up, as did marijuana use.
You nailed it. I think that while they don't have that clear data, really, we know it because we're seeing it. I mean, yes, there's an increase in vaping. And then the other reason is the other side of that, smoking tobacco is dropping all over the US. So as we're seeing tobacco use go down significantly, as I displayed in one of the first slides, is dropped drastically over the last almost 10 years or so, or 15 or whatever it was. And then we're definitely seeing vaping going up. So you're leading right on into, this is kind of why I asked you, it was a leading question into the next slide, which doesn't show for pregnant mothers because I don't find that directly very easily. So this is just percentage of adults age 18 and over who currently use e-cigarettes. So all adults 18 and older. I'm not even going to look at youth today because I could spend literally another hour talking to you about youth vaping alone as well. So I just don't have that kind of time. And really what this displays to me is like cigarettes, our males are using electronic cigarettes or vapes at a slightly higher percentage than females. And not surprisingly to me, the age group making up the largest current use of vapes are those 18 to 24. So, which was the same age group that had the highest smoking rates for pregnant mothers. It was 20 to 24. So I think we would see the same, being that this was a huge youth trend and marketed to youth. And as they're aging out of youth years, they're now in our 18 to 24 years old. So let's get into the vaping aspect of this. So, what is vaping? Why is it called vaping? It's the act of inhaling or exhaling aerosol. So that's going to be a key focus here. And it's often incorrectly referred to as vapor. And that's produced, the aerosol is produced by the electronic vape. So there are a few reasons why it's called vaping. First of all, I always joke that aerosolizing doesn't roll off the tongue too easily. And the main reason, though, is that the industry wants consumers to perceive safety. So I want to ask you, when you hear water vapor, that term, because they've said nicotine and water vapor, what do you think of? Again,
Boiling water.
boiling water, yeah. What
For
anything
tea.
else? So yeah, I was like, yeah, I think of like when I'm steaming vegetables. Someone put something in the chat, which can somebody read that? It's hard for me to switch from what I'm viewing to play the chat.
Hot water is what.
Yeah.
is in the
Right,
chat.
hot water, boiling water, steamy showers, humidifiers you use when you're sick and you have the humidity going in the room. What about just vapor? There's one thing that came to mind immediately, and I have a coworker who uses it religiously whenever they have a cold.
Vicks Vapor Rub.
Yes, Vicks Vapor Rub. So again, the tobacco industry is tying into the message of products associated with making you well that we already associate with like safety or wellness. And that's just a trick out of their playbook. And think about this, they've lost sales to traditional tobacco products, and they are now manufacturing vapes and trying to send this message out there so that people, will use their products and they still continue to be wealthy, not the people, the industry. So it's also very important to understand how vapor and aerosol differ. So a vapor is a cloudy diffuse matter suspended in the air, such as mist or steam, or the things we were just saying. And there aren't many other particles in it. Aerosol is a suspension of many tiny particles of liquid, solid, or both within a gas, such as fog, dust, haze, smog, smoke, and it leaves a residue behind. That's really important, and the residue can be harmful. So I want to get you to think about, if I were spraying a bottle of water onto my hair, of course it would feel wet when I just sprayed it, but once it dries, it will likely feel the same as it did before I sprayed it. Now consider if you spray hairspray into your hair, which is an aerosol. What does that feel like, and how does that change after you spray it into your hair?
It hardens.
Yeah, it hardens, it stiffens, holds the shape. That's chemical residue left behind from aerosol. So think about that when you're vaping and you have residues being left behind. And we'll talk about what is in that aerosol, the liquid, the aerosol, or therefore the residue, in just a moment on the slides ahead. So, and also it's important to note that the bystander or standing around someone vaping, you're breathing in the secondhand aerosol residues. So just like third-hand smoke, which we have when we have secondhand smoke when you're the bystander next to someone smoking, but third-hand is the residue left behind when someone's put it out. You still smell it in the hair, you smell it on your clothes, things like that. So you have the same thing occurring with the secondhand aerosol and residue. So I just wanted to display a picture to talk about the different vape products and what some of them look like. This is not comprehensive. There are so many different products. In fact, when I was looking up for this, it was 460 different brands on the market. and like something like over 7,000 flavorings. That's just crazy.
Mm.
And they're constantly changing. So it's really challenging to get current data on these products, because as soon as you get it on one, it's already something else. It's old news. There's 10 new products out there, and much less data on how it affects pregnancy, since we know that nicotine is a teratogen and most vapes contain nicotine. And then most e-cigarettes consist of 4 different components. So I'll share what they are. They are the cartridge or reservoir or pod, depending on the type of vape product. And this holds the liquid solution, which we'll most likely be calling e-liquid or e-juice. And it contains varying amounts of nicotine, flavorings, and other chemicals. And then there's a heating element. This is going to become important, called the atomizer, and a battery source, which a power source essentially, and then the mouthpiece that they put into their mouth to inhale the product. So it's really important to talk about the potentially harmful substances in vape products, because they're not talked about and people are misinformed drastically across the board, I think. So nicotine and water aren't the only things in the cartridge holding the e-liquid, as was previously the first thing we ever heard about it. Although, you know, I don't think breathing in a high volume of tiny water droplets repetitively would be safe either. I've had some people joke and call that, you know, what point do you call that aspiration or drowning, breathing in water constant directly into your mouth? Anyhow, so many electronic vapes include a mixture that also contains the substances listed on the slide. And we're going to discuss each one over the next several slides. And this is where I'm having to paint a bigger picture for you up front before there is enough data to directly say how it would impact pregnancy. Okay. So the first substance, of course, is nicotine. And that's also a natural insecticide. It is the addictive substance in electronic vape products and tobacco products. And the nicotine is rapidly absorbed from the lungs into the bloodstream and in the brain. Upon entering the brain, it stimulates your adrenal glands to release epinephrine, norepinephrine, as well as, that increases respiration, blood pressure, heart rate, and the most addictive substance is like nicotine. It activates the reward circuit in the brain, increases chemical messengers like dopamine, reinforces rewarding behaviors very powerfully, known as addictive as heroin and cocaine. In fact, nicotine is. It's pleasure caused by the nicotine interaction with this reward circuit, coupled with the withdrawals shortly after that someone experiences, is what motivates them to use nicotine again and again, despite the health risk. It doesn't mean they're a bad person, a bad mother. It is just that addictive, sadly. And as previously discussed, nicotine is particularly harmful to a developing brain by exerting the neurotoxic effects in the prefrontal cortex, interfering with the adolescent's cognitive development, executive functioning, and inhibitory control. So basically, they make bad decisions. Electronic vapes containing nicotine are a health danger for a pregnant woman and her developing fetus. So particulate matter is the next substance, and this is a mixture of solid particles and liquid droplets found in the aerosol that is inhaled from an electronic vape product. And these particles can be really large, you know, like dirt, soot, smoke, and just dark enough to see with our naked eye, or they can be extremely tiny that only an electron microscope could see them. And we have displayed in the picture the different size variations in those particles. And the issue with this is they're so tiny, you can very effectively deeply inhale the nicotine and other chemicals that are contained in it that can also cause damage to the respiratory and cardiovascular system. So electronic vape product liquid or aerosol contains base constituents propylene glycol and glycerol. Propylene glycol produces the visible aerosol, so the cloud seen as is also used in artificial smoke and antifreeze, actually. This can cause eye, throat, and airway irritation. And then the glycerin-based oils, which are often contained in this liquid mixture as well. Glycerol, or vegetable glycerin, is an oily what's called hygroscopic liquid with a warm, sweet taste. Interesting that it has a warm, sweet taste. It would make it more palatable, right, for someone to inhale in. When the glycerol is heated, it forms aldehydes, and I'm going to explain what those are, but some are named here: acrolein, formaldehyde, and we'll talk about why is that a problem. So aldehydes are carbonyl compounds that are found in vape aerosol. They are cancer-causing chemicals absorbed by the respiratory tract. They are addictive like nicotine because they create alcohols absorbed by the brain when heated, and the higher the heat, the higher the aldehyde level. So some of these have voltages on the vape product that they can increase, so they can turn up the heat on the product. They also potentially cause cardiovascular disease, aldehydes. And formaldehyde is used to make chemicals in resins and as a preservative, as you know, for preserving dead bodies. And it causes leukemia and cancer in respiratory tissues. Acetaldehyde is used in the manufacturing of acetic acid, perfumes, and flavors. It causes irritation of mucous membranes, and large doses could cause death from respiratory paralysis. So I know this is term heavy and a little bit difficult, but it's important to explain these things to get a lot better understanding that it's not just nicotine and water vapor, in fact, that people are inhaling. So chemical flavorings in e-liquid may not be toxic by themselves, but become toxic when mixed with other chemicals and when they are aerosolized. And according to a study published in the journal Nicotine and Tobacco Research, the flavor aldehydes diacetyl, vanillin, cinnamaldehyde, benzaldehyde, citral, ethyl vanillin, they rapidly react with propylene glycol and glycerol to create a compound called acetyl after mixing. The problem with that is the acetyls irritate the eyes, the mucous membrane of the respiratory tract, and repeated exposure can cause headaches, dizziness, drowsiness. And in a laboratory test, a separate research team exposed white blood cells, which obviously are essential to our immune system, to common e-liquid flavoring chemicals in typical e-liquid mixes that didn't even have nicotine in them. And the mixed chemicals caused significant inflammation in the cells and even killed them. So they were cytotoxic, the killing of cells. And cinnamon, vanilla, and butter flavoring, like diacetyl chemicals, were the most toxic. But the research showed that mixing the flavors of the e-liquids, which occurs when vaping, cause far more toxicity to white blood cells. So interesting. Okay, so e-liquid also contains VOX. You might hear the term VOC, but it's a volatile organic compound. In this case, we're talking about benzoic acid. It's the primary ingredient for making nicotine salts used in many vapes easier to inhale. Benzoic acid has a role in antimicrobial food preservation, but it is not safe for inhalation. And since I'm using the term nic salts, and you probably don't even know what nicotine salt is at this point, because I didn't before I was taught about it here. What they do is nic salts absorb faster into the bloodstream. They deliver a smoother, more satisfying hit, and it's really the industry would term it as a perfect for beginners type of nicotine. And it's best suited for pod-based vapes, and it makes a more constrained cloud, so a more concealing cloud. So you saw that in Juul and Puff Bar and all the little USB-looking vapes that came out previously. And it's like wonderful. We have this nice, discreet tool for children to get hooked on, and be so addicted to this product. They knew cigarettes weren't safe, so the tobacco industry had to come up with a new product to addict a whole new generation. So it's probably, unfortunately, some of your children out there, as we have had struggled with that here. Not our own employees, but our employees' children, who are exposed to this. It's really just sad. So let's get back to the nature of exposure to benzoic acid. This can cause eye damage, irritation of our skin, resulting in a rash, irritation of the nose, throat, lungs, if it's inhaled, which can lead to coughing, wheezing, shortness of breath. Boy, does this sound similar to smoking at this point. And then e-liquid also contains heavy metals that are linked to cancer, lung disease, gastrointestinal, and brain disorders. And the more metal parts that there are in an electronic vape product, the more heavy metals that are found in the aerosol that it's produced. And the concentrations will also increase again when we turn the voltage up on the ones that are modifiable. I don't know if any of you have ever watched any videos. You can literally Google it, YouTube it, whatever, you'll come up with thousands of videos showing you different components and parts from usually youth, unfortunately. And I've seen the coils inside of there that they can change out as they wear down. Well, if they're wearing down, where do you think the particles are going? They're breaking down and you're breathing them in. So just keep that in mind. Try to think critically when you're comparing, you know, is this safe or not, or having that discussion. So another substance found in electronic vape product liquid or aerosol is something called a tobacco specific nitrosamine, or TSNA. And although tobacco specific nitrosamine levels are significantly lower than the TSNAs found in cigarettes, e-liquid still contains them. They're carcinogenic. I'm sorry, but I'm of the mindset that it only takes one carcinogen to potentially do damage. So I don't want to purposely put that in my body. If I can not use it at all costs, I will try not to, and also try to help inform others so that they can make that informed decision not to use this product. So here I want to talk about some of the diseases that we've already seen associated with electronic vape product use. A recent study on vape products found that using them raises someone's risk of developing long-term lung disease. Lung diseases linked to vape use include asthma, chronic obstructive pulmonary disease, or COPD, like bronchitis or emphysema. So bronchitis is inflammation of the bronchial tubes and irritation of the airways. Emphysema is destruction of the alveoli. They don't expand and contract as they once did when healthy. And unfortunately, COPD is irreversible. And this is also something that we very commonly see in long-term cigarette smokers. So we're starting to see some of the same problems. And those who use, this is very interesting, they are using vape and cigarette, both products, that's called dual use. They're at an even higher risk of developing lung disease and heart disease compared to someone who's only using vapes or only using cigarettes. I found that to be extremely interesting. Other studies confirm that vape use weakens our lungs' immune response to infection. Not good when you're in a pandemic and just coming out of one. Makes it harder for the lungs to fight off harmful viruses and bacteria. Another important health implication from some of the chemicals found in vapes, there's not a direct correlation yet, but there's sort of an association, and I'll explain that. So bronchiolitis obliterans is a condition. It's inflammatory. The bronchitis means inflammation, right? And we're talking about the bronchial tubes, so inflammation of our bronchial tubes. And I said that really messed up, but that's okay. I'm human and we all make mistakes. But there's scarring that occurs in the lungs, and this eventually can block airways and make it difficult for the person to breathe. It's best known, the layman's term, as popcorn lung. Anyone remember this? Heard of this? Popcorn lung? I'm seeing a head nod. I can only see one person right now, but maybe more of you are saying yes. It's mentioned on the last bullet there. And so it's confusing a little bit because you think like, oh, it sounds like popcorn or it looks like popcorn. Actually, it has nothing to do with that. In the popcorn factories, the same flavoring that makes the popcorn buttery, diacetyl, was the workers were being exposed to that, and thus it got coined the term popcorn lung. So that's bronchiolitis obliterans. And here we are finding diacetyl in vapes, right? And some people may say, well, it's approved as, under what's called GRAS. That's generally regarded as safe for ingestion in small amounts, but it's not approved for inhalation. And it's been proven to cause issues. And there was a study that found 150 sweet flavored e-liquids of 150, 69% of them had diacetyl in them. And then 47% had them at concentration that was above the occupational safety levels. And then another study had similar results that found diacetyl in 39 of 51 tested vape liquid flavors. And two companies that said there's no diacetyl in here. They found it in there. So their labeling is misrepresented. And there is this chemical in there that is potentially harmful. And the signs and symptoms of this bronchiolitis obliterans or popcorn lung are dry cough, shortness of breath, wheezing, fatigue, crackling or rattling sounds in the lungs. And while there's, again, not any current long-term studies that can link vape products use to this condition yet, current data more than supports that diacetyl inhalation is the most well-known cause of artificial flavoring-induced respiratory disease. And that's been known since the early 80s. Scientists have discovered that vape products aerosol can impair the function of our blood vessels by making them stiff. The stiffness can decrease blood flow throughout the body and lead to blood clotting. This damage can even occur from using or breathing in the secondhand aerosol, as we mentioned earlier. So there was a small study, and this is so small that I feel almost embarrassed to use it, but it's also a really important piece of information if they could replicate this on a larger scale. So I will say it. It was from the University of Pennsylvania School of Medicine. They had 31 men and women with an average age of 24. And these men and women took 16 3-second puffs of aerosol from a vape that had no nicotine in it. Before and after the vape session, each person's femoral artery was compressed in the upper leg for a few minutes and then released while an MRI machine monitored the artery. The constriction was similar to that you can think of a blood pressure cuff. And when the cuff relaxes, the artery expands, and if the vascular system is healthy, the blood surges to replace oxygen and nutrients to that limb that has been denied for the period of time that it was cuffed. So in this study, again, this is a non-nicotine vape, it found that after they vaped, the femoral artery expanded 34% less on average due to reduced blood flow. These are young, healthy people, 24 years old, no nicotine, and it was still causing problems with expansion of their vascular system, which suggests that it's doing damage to the endothelium, which is the inner lining of our blood vessels, right? And this damage in this study lasted for about an hour. So it was short-lived, but still, it doesn't point to a very positive status for the vascular system when you vape, especially if we were considering what that might look like long-term when we can have more data on that. So using electronic vape products during pregnancy isn't safe. And most vape products contain nicotine, which again, we talked about how that affects brain development for children. The e-liquids also contain chemicals, flavors, and additives that might not be safe for that baby. And it's well known that smoking cigarettes during pregnancy can harm women and their babies, but research suggests that pregnant women who vape believe that using electronic vape products is less harmful than smoking cigarettes. Pregnant women often don't know if their vape even contains nicotine, or they think that maybe it doesn't. And some might use vapes during pregnancy because there's a perception that the device can help them quit. But in fact, quit smoking. But in fact, it's not approved by the FDA as a cessation aid. So they've come to that conclusion, I guess, by the industry who's selling the product who gains profit off of them. While the use of vape products might expose a growing baby to fewer toxins compared to those from a regular cigarette use, nicotine exposure of any kind is harmful to a baby. I have two things I say, but I won't say one for the nature of all the shootings that have happened so recently, so I'll say the other one. And it's like thinking of saying, well, it has fewer toxins, or it's safer. Well, it's safer to fall. I heard a guy say this once who used to work for the tobacco industry. He said, well, it's safer to fall from a 10-story building than a 100-story, but the outcome still might be that I'm harmed or hurt or dead. And I thought, man, that's never going to leave my brain. So I wanted to talk a little bit about also safety poison control concerns. So this is national poison data here. And as of August 31st in 2023 so from January 1 to 2023, August 31 of 2023, excuse me, we had 5,138 exposures of e-cigarette devices and liquid nicotine. Sadly, half of those calls are related to incidents involving children. That's so sad, right? And again, nicotine is highly toxic, particularly through dermal eye contact or through ingestion. So it doesn't take really a whole lot to be lethal, about 60 milligrams for an adult and 10 milligrams for a child. So how do we convert and look at that as a liquid? When looked at as a liquid measure, I found that it was estimated about 45 milliliters of e-juice had enough nicotine in some cases to be lethal to nearly a dozen children. And this is just laying around some people's house where kids can get into it accidentally. So there are a number of symptoms that you want to watch for if they do have exposure, and it's called NIC sickness, nicotine sickness. And, listed here are some short-term issues in less than an hour. Basically, they might have they're salivating, nausea, vomiting, loss of appetite, their stomach hurts, they have a rapid heart rate, increased blood pressure, their head is hurting, they're having rapid breathing, they might feel dizzy or tremors, confused, anxious, but later they may start to experience diarrhea, shallow breathing, a lowered heart rate, decreased blood pressure, fatigue, weakness, they have pale skin. So if this is occurring, call 911. And all right, so let's switch gears. I am getting close to the end here, and I just want to mention that, it's important to ask your patients about their tobacco use and advise them to quit. So recent studies show that brief advice from a clinician about quitting yielded a 66% increase in success of quit rates. So how you discuss tobacco definitely matters, and you probably should start with determining what stage your patient is in with regard to their readiness to quit. To do this, we always encourage you to use the skill motivational interviewing and techniques that come along with that. Again, I could talk another hour about that alone as well. But you could start off the conversation with something like, would it be okay, or would you like to talk about your tobacco use and where you stand on your readiness to quit? So it's non-defensive stance. And just 4 key principles for motivational interviewing are expressing empathy. So listen to them. Don't tell them what to do. Develop discrepancy. This is a very important one. Help them see that their current behavior is not in line with their well-body goals or their pregnancy goals in this case. And then avoid arguing with them. Help them make their own argument for change. You don't want to make the argument for them. And then support self-efficacy. Point out progress. Build their confidence and belief that they are capable of making change. So as mentioned previously, someone said Healthy Start resources where let's talk about tobacco and script. So those are available to your pregnant mothers, as well as Tobacco Free Florida's resources, which I'll cover the next several slides, because we also want to consider, the family members, the fathers, the other relatives that may be in the home, the partners, whatever. And then the Healthy Babies Initiative that is going on in some of the counties that has incentives as well. Different programs, if they come to a cessation class, are providing, a diaper bag, a stroller, a car seat. So this is another incentive to get them to attend. So Tobacco Free Florida has the Quit Your Way resources. And that really is phone quit now, which is individual counseling, and then group quit. And I see my phone number aligned over in the wrong place. So that's 224-9340. That's my office. So group quit, I'll just explain that in a little more depth very quickly because I am running out of time. It's face-to-face or Zoom. We use this platform very often. Group counseling sessions led by a tobacco treatment specialist. The replacement therapy, patch gum lozenges provided for free, but I will note the caveat of the pregnant mothers and the decision with their healthcare provider and whether or not the benefits outweigh the risk. With regard to their current, tobacco use or vaping status and their willingness to reduce that or quit it altogether. But also, this is for 18 and older and for Florida residents. We have 3 different types of cessation classes. One most commonly used by the general public is the Tools to Quit, and it was morphed out of the former, or really the flagship program called Quit Smoking Now, which was 6 weeks, but now it's a 4-week, 1 hour per week class. Not as commonly utilized for whatever reason. The multi-session public classes don't have the best uptake, so most people want that one and done class to just get the information in the product and apply it right away. And then lastly, the Journey Starts Here, or Journeys, is a 6-week program. We have lots of attendees. That one is flourishing, but it is closed to behavioral health sites and substance use recovery sites. But we've got quite a few. I just got a new one over in Bay, called Bartels and Eden Springs or something like Eden Shores. That used to be Right Way Ministries, and then Recovery Base Center. And then we have one in Alford, Florida. And several others, but that doesn't impact your counties. I guess I was just trying to name some that I know we do in Bay County. I have a sample flyer. We have many different materials to help you promote to your families about different ways they can use free resources to quit tobacco. If you want to refer patients, you can use the fax referral form. There are several ways to submit referrals actually. So it could be the fax, it could be secure emailed. It can be, we can create an automated referral link, and we could even set up electronic referrals depending on what EHR you have. So I want to mention these prescription medications, varenicline or Chantix and bupropion. They're just kind of insufficient studies, but preliminary information shows no evidence of teratogenicity. Again, data is limited, so anytime, obviously, it's a prescription anyways, they would need to talk with their healthcare professional about the safety and or risk. But lastly, it's important to note that both of these medications, bupropion is also like Wellbutrin, an antidepressant. They help with, while they help with cessation, they are transmitted to breast milk. So just more research would be needed, but every time they're doing research, it's basically, for a lot of these cases, stopped when they see, oop, there is a problem. We don't want to put risk to the baby, so they can't easily study it when they know there could be a problem. We already mentioned that e-cigarettes are not FDA approved and not an effective quit tool across the board, not for pregnancy and not for the general population either. So I will briefly mention the FDA approved over-the-counter medications that are provided from the health department, as well as Tobacco Free Florida's Quit Your Way services, patch, gum, and lozenge. We talk about this in depth in a cessation group class, how to use it, what strength to use, when it's indicated, in all of the above. They're going to get a 4-week supply for each group quit class that they attend. And then, as I was mentioning, nicotine replacement therapy during pregnancy, the ACOG, or American College of Obstetrics and Gynecologists, has some recommendations. And also the U.S. Preventive Service Task Force concluded that current evidence is insufficient to assess the balance of the benefit and the harms of nicotine replacement products or other pharmaceutical medications for smoking cessation during pregnancy. And trials studying the use of nicotine replacement therapy in pregnancy have been attempted. As I was mentioning, many conducted in the U.S. have been stopped by data and safety monitoring committees for either demonstrating an adverse pregnancy effect or failure to demonstrate an effectiveness. And here they mentioned that if nicotine replacement therapy is going to be used, first and foremost, I will say that they need to make this decision with their healthcare professional. But if it's going to be used, it should be with clear resolve of the patient to quit smoking. And intermittent dosing, like the gum or the lozenge, would be the first line of medication over the patch, because they intermittently give nicotine, whereas the patch constantly gives nicotine. And that nicotine, as we talked about early on, goes to the fetus in higher concentrations than the mother. So transdermal patch would be last resort. But again, you have to weigh the pros and cons. If they're smoking heavily and they're not considering quitting that, or they can't do it without replacement therapy, then pro-con debate with their provider on what's going to be best for them in this circumstance. Ideally, no smoking or no nicotine for best outcomes. I did want to show you where AHECs are located across the state of Florida, where nonprofits were associated with the colleges of medicine across the state. And my area is the red 1 and 2 there, the Big Bend region. But we cover all 67 counties with the tobacco cessation services. And then I did say early on that I was going to mention the Navigator program, because open enrollment starts tomorrow. We have something like 14 licensed navigators with our AHEC now that covers 18 counties at this point. So it goes west from over to Escambia area near Pensacola, all the way back to Jefferson, Madison, and Taylor, and everywhere in between. And so this is the Patient Protection and Affordable Care Act, or the ACA, and Federal Marketplace Exchange. And I know I'm very low on time, so I want to really get to the nuts and bolts of this. What do AHEC certified navigators help with? We don't sell health insurance. Don't get that confused. We help people enroll. The plans there's a lot of plan options on the marketplace, and they're difficult to navigate. So there's someone there for free to help people through this. And if it's not a fit for them, we determine through asking several series of questions, then we can refer them to Medicaid, Medicare, or Florida Kid Care, or whatever as needed. And then, so we would ask them permission. Do they have income? Because to qualify for the tax credits, there's a minimum income around $14,000, and then it goes up for every family member they have. And estimated incomes, are you applying for health coverage or someone who is a legal resident of the US? Will you file your taxes, and does your employer offer insurance? So this helps people determine if they're even going to qualify. And I actually use this just to say, because it was expensive when my spouse and I had the baby it was going to be very expensive to add on through my work. They cover me, but we have to pay the premium for the family. So I went through the marketplace and I pay less than half for them. So it is nice. It was a wonderful benefit right at my fingertips to do. I did it virtually with one of our navigators. Anyhow, so there's the information there. If you know someone in need of this, please contact our office so they can sign up for appointments on the website or by calling the office. So thank you for allowing me to say that. And thank you for bringing me in for the presentation today. I hope that you found something useful, interesting, a nugget that you can take from this. And if you have questions now, I'll take some, or afterwards, I've got my contact information. And so that I can see everyone, I'm going to stop my share. And if you do need this information, they can share it with you. All right, I'm sorry that I ran so close to time, but I told you there was so much information to share. So
Emily, we've had a few people ask too if you could share your slides, if that's possible.
It is, and if you'd like to bring me out to speak to another set of people, I can do that as well. So sure.
Yeah, we've had a couple people that have said, can you please send your slides or share them with us? So I wanted to throw that out there.
Okay, I appreciate that, because when I am sharing screen, I can see that a message is coming through, but it makes my view strange if I open it up while I'm in share screen. So I didn't want to mess up my flow. So I apologize. I missed it as I went. And I see now that someone says I was breaking up. I hope I wasn't breaking up too much for too long. And I'm in the office, so that's so could I just share I'll probably share it as most likely a PDF, as that's what they typically do across our sharing schemes to you, and then you can distribute to this group that participated, or how should we, because it'd be hard for me to send to each individual. We'll get an email list from the Zoom and we can share it that way.
Yeah, if you send them to me, Emily, then I can distribute them to the list.
Okay, thank you so much. Any other questions or comments right now? Did you learn anything?
No, thank you so much for giving us your time.
Absolutely. Anytime.
No, Emily, I thought it was very, very concise. You did a great job. You covered a lot of areas in a limited time. You did excellent. Thank you so much.
Thank you. Thanks for having me. Well, unfortunately, these mothers using vapes right now will be the guinea pigs, and in time there will be more and more data to get more specific, about how it's impacting them directly. But you could see a lot of you can make inferences essentially about how it wouldn't be safe from the chemicals and the harm that we can see it does to the adult, and how that wouldn't be safe for a developing embryo or fetus, like logically. So
Most definitely. And Emily, the slide where you talked about safety concerns for children under 5, children just in general, having access to vapes just lying around at home, different things, really opened my eyes. I know it can happen, poison happens, but I guess I really hadn't even thought about that, and you really brought that to my attention.
right.
Too. And then the NIC sickness, was something
Yeah.
that opened my eyes.
I hadn't even really thought about the Nick sickness too much either. My boss had done a variation of a different presentation on tobacco use during pregnancy, and she's a nurse, so she focused more on what are the health effects, what do we look for, and how do we like deal with this in a sort of emergency situation. So
Does anyone have any other questions or for Emily?
well, we're at time, so I want to respect everybody's time on that note. That was my first time presenting that. So thank you so much for being my guinea pigs.
Thank you so much.
Thank you, Emily. This was great, and we appreciate everyone coming for our very first lunch and learn today. And we certainly will be doing more of these, and probably will ask Emily to come on again and share. But thank you, and I hope you all have a great day.
Okay, thank you, everyone. Bye-bye.
Thank you.
Let me see. Looking at the chat one last time here. All righty, thank you. Have a nice day.